Okay. So, we are continuing the sleep public health quality of life cognitive function lecture. And I just wanted to review some of what we went over in class, just because we had to rush through it because we were trying to do two pretty long activities at the same time. So, first of all, we use the Human Development Index to sort of rate countrywide quality of life. And these are some of the areas that we evaluate. And we talked about some things that might be missing, such as socioeconomic status, right? It doesn't talk about distribution of wealth, just total gross national income per capita. That doesn't mean that it's taking into account how that wealth is distributed. So, in countries such as the United States, right, there is a significant wealth gap between, say, the top 1% and the bottom 50%. But additionally, and you see even greater gaps in other countries such as Brazil. Okay, so, but that's not accounted for in the Human Development Index. Same thing, things like safety, race, sex disparities, right? We're not going to see any of that. Happiness, quality of life. We don't see that on an individual level here, even though this is sort of acknowledged as a gauge for countrywide quality of life. We talked about how these are some other aspects that you might be looking for in a place that you'd want to live. Longevity, of course, but then, of course, the 9 characteristics of blue zones. Um, and you see some examples here, and I went through those in class, so I'm not gonna do that again for you. Oh, I did want to mention that they don't cover sleep in here, which seems to be an omission for me. I guess they didn't see it come up, but it may not have been a question that they were asking as well. So anyway, it would be interesting to know sort of what happened there. These were 24-hour movement guidelines. That was for 65 years and older, in particular, but similar guidelines exist. So if you look at the boxes, right, those similar guidelines exist for um, adults across the lifespan. Okay, and this is sort of where we stopped, and I wanted to pick back up. So, one, we have the American Heart Association Simple 7, which we saw, I think, a couple weeks ago briefly. And that became Life's Essential 8 in 2022. So they added sleep to that. And this was an article looking at defining optimal brain health in adults and just highlighted some ways that we could potentially improve cognitive function. So first of all was paying attention to Life's Simple Seven, remaining physically active, right, which is part of Life Simple Seven. The Mediterranean diet, which when you get into it, right, it affects a lot of Life's Essential Eight. Um, Maybe I'll get into that a little bit later. But preventative care and lifestyle modification. So again, that could be applying to a lot of Life's Essential Eight, as well as some of those characteristics of blue zones. Preventative care and access to it now through the Affordable Health Care Act is mandatory to be covered by insurance companies. So that was sort of a step forward in that direction. Looking at some modifiable risk factors would be important. Things such as alcohol consumption, physical activity, right? Sleep, all of these are potentially modifiable. Diet. One that I think is really interesting is providing opportunities for stimulating cognitive, physical, and social faculties. So one area to do all of these with is something like a group fitness class, for example, or a group dance class, especially. So lots of social engagement there, definitely some physical activity. A lot of cognitive engagement as well, because not only are you moving and you're learning something new, but you're also having to do that thing to a rhythm. And so there's just a lot of mental engagement in an activity like that. And the last one they mentioned here, or that I wanted to highlight here, not that they mentioned, was neighborhood. So environment plays a big role. And so some of these things, right, are modifiable. Some of these things we can change, but some of them we can't, like neighborhood safety, right? I'm not going to recommend that somebody go for a walk to increase physical activity if their neighborhood is unsafe. Similarly, preventative care, right? If that isn't covered by insurance, the chances that I'm going to engage in that are pretty low. Like, it's just not possible. Mediterranean diet, right? Maybe a little bit more modifiable there. But even then, right, food choice, food availability, things like food deserts are all going to affect my ability to even make a dietary change. Okay, so again, sort of trying to zoom out and look at things, we really focus on 24-hour behaviors, but there are lots of ways to improve public health looking at things like social engagement, active aging, technological innovations, right? Sociocultural dynamics, environment, socioeconomic environment. So there's just a lot of things that we can focus on. But one of the areas that public health is really focused on and has increased their focus on lately is cognitive function. So we're going to go into that for the next couple of slides. But note, obviously, physical functions there, mental health, social health, and sleep all made the list in this particular article on active aging and public health. Okay, so what does physical activity do for us other than improve our physical health? So I think it's in class this week, and for sure in the article that you're reading this week, we're going to cover a little bit more about mental health, and towards the end of this presentation, we'll cover some too. But we were trying to look at cognitive function with our in-class activity last week in terms of that movement break, and then looking at the Stroop color test. But note that there's a ton of different ways to look at cognitive function. So yeah, we could improve cognitive performance, but then there's lots of different areas like memory function, episodic memory, visuospatial ability, immediate memory, speech function, time delay, attention, episodic memory, executive function, right? So there's all these different aspects of it. And on top of that, there's all these different ways of measuring those things. So this is just focusing on cognitive function, this chart is. So, or on executive function rather. Note that executive function in this list, it's one aspect of cognitive function. And in that one aspect of cognitive function, we've got a million different ways to measure it and also four subcategories. So when you hear, let's say someone on social media talking about cognitive function and brain health, right? What if they're talking about a specific study? Okay, well, maybe physical activity doesn't improve brain function. Okay, what aspect of brain function are we talking about? Memory? Are we talking about visuospatial ability? Are we talking about executive function? Just because it doesn't improve one aspect of cognitive function doesn't mean it doesn't impact other aspects of cognitive function. So we were focusing on one aspect of cognitive function and then the inhibition subcategory in cognitive function and focusing on a single way of testing that that function. So this is really, really niche and specific. So if somebody who has no background in studying cognitive function is telling you really striking big findings about cognitive function, you should be a little concerned and you should be thinking, okay, what aspect of cognitive function? How did you measure it? Right? That should be bare minimum questions that come to your mind. Okay. So, but we use the Stroop color test to measure executive function and specifically inhibition. Note, there are limitations to every test. For example, one limitation of this test, and maybe some of you talked about it in your post-class engagement, was what if someone's colorblind? Right? They literally could not have performed the activity that we did. So there's a little bit of there's a huge issue actually with that in terms of inclusion, right? And the ability to measure and make general statements about the population because we systematically excluded people who are colorblind in that specific test. Okay, figure on the right here. So this is obviously a picture of the brain. For cognitive function, a lot of our measurements focus on the changes in the hippocampus, so the cingulate gyrus, and then you have the dentate gyrus down here, right at the edge of that, the hippocampus as well. So I just wanted to point that out. Okay, this I'm not going to go over too much, but this was a really cool study looking at changes in executive function with acute physical activity. What the study found was, and we've seen these leaf plots before, right? What the study found was that there were, as a result of physical activity interventions, there was an improvement in cognitive function for pre-adolescents and for older adults, but not really for these middle categories, the adolescents or the young adults. And so note that the paper was suggesting that essentially in periods of significant developmental change, we may see a greater effect. Although for some adolescents, depending on how you define it, there's tons of changes happening here. So I'm not sure I totally buy into their argument, but in any case, you may see even more changes in pre-adolescence, especially with brain development. So sort of some interesting findings here. But know that a physical activity intervention is more likely, according to this systematic review, it's more likely to be beneficial for pre-adolescents and older adults as opposed to other facets of the population. So if indeed there is an improvement in cognitive function with physical activity, how is that happening? The primary mechanism that has been explored is improvements in BDNF alpha, so which is brain neurotropic factor, which promotes neuron growth. Okay, so we know that with physical activity there are increases in BDNF. And possibly an IGF-1, which could stimulate some tissue growth, so insulin growth, insulin-like growth factor, and then also VEGF, which VEGF that's also very well supported. IGF-1 is not quite as well supported, at least in terms of the brain, seeing increases in IGF-1 in the brain. We do see increases in IGF-1 and VEGF with physical activity in the bloodstream typically, but whether that's crossing the blood-brain barrier or not, I don't know the research well enough to tell you. But in any case, we would expect to see some increased neuronal growth, maybe some tissue development, and certainly some angiogenesis, so sprouting blood vessels, so an increase in the amount of blood that's being circulated throughout the brain. So you can imagine how that would result in improvements in cognitive function. Specifically, we could expect to see some increases in hippocampal volume with chronic physical activity, which it would improve learning and memory. We would see increased neurogenesis in the dentate gyrus, right, which I was showing you earlier, which would likely affect memories and depression and improve mood. Improvements in executive, visuospatial, and pattern separation. So some different aspects of cognitive function there. And then improvements in relational and memory and academic achievement, but those findings have only been confirmed in adult or in children. And note in the bottom right-hand corner, I just have some citations there for you. So those are all pretty relatively, other than maybe the 2008, we would consider them relatively recent findings. And we certainly need more research in this area. So if I then was prescribing based on these 6 studies, if I was going to prescribe physical activity, the things that I would look for if my goal for the physical activity intervention is to improve cognitive function, I want longer duration of the study, so greater than a 12-week intervention to really see significant impact. Higher intensity was associated with greater improvements. Longer duration physical activity, so greater than 11 to 20 minutes. Again, note that our physical activity intervention was 10. Timing of exercise, it looks like morning for cognitive function specifically, right? That morning exercise might have a slightly greater impact. Note that that's probably not true for other aspects of health, though. So things that are being studied right now are the impact of morning versus evening exercise on blood glucose regulation. Jason Thomas, a graduate student at the University of Utah, is doing that right now. And we see things like studying the effects of an exercise resistance training program on hypertrophy. And it looks like in both of those cases that evening exercise may be more effective. So depending on the intervention that you want, we may exercise at different times, or the adaptation that you want, we may exercise at different times. Now, just for the record, the magnitude of those effects are pretty low relative to just the effect of exercise versus non-exercise. So I'd certainly expect an improvement in cognitive function with exercise, period. So is it really critical that someone get it in the morning versus evening? No, because the difference that I'm going to expect there is maybe that big, like the magnitude is going to be quite small, as opposed to physical activity versus no physical activity, the magnitude is going to be much larger typically. Concurrent training did seem to be more efficacious than either aerobic or resistance training alone. So engaging in aerobic and resistance exercise seems to be helpful. Baseline fitness level, right? So that makes sense. If you have low levels of fitness, you have greater opportunity for improvement, particularly with something like angiogenesis or tissue growth. Okay, so low levels of fitness. If you start with a low level of fitness, you're more likely to experience cognitive function changes and improvements. Okay, yeah, moderate effects on those. I'm going to just skip down to there was no sex-based differences in any of the physical activity interventions on cognitive function. So males and females both seem to be benefiting from physical activity interventions. It does look like like I said in the last slide, that younger and older populations seem to have a greater benefit than sort of middle-aged populations, and no differences between aerobic or resistance training. So both seem to be helpful, while concurrent training seems to be the best. Okay, then I want to move over to this figure on the right really quickly, just because it really applies to, and this was sort of where I got the idea for our in-class intervention. So first we have people immediately following exercise doing a cognitive function test, and then after a delay following exercise. So in this study, the delay had to be at least 20 minutes. So they did a physical activity intervention and then waited 20 minutes to retest cognitive function. And then this was modulated by exercise intensity. So what they found was that immediately following exercise, right, if you're doing very light or moderate activity, there seems to be some improvement in cognitive function. However, that changed if you were measuring cognitive function 20 minutes later with very light activity. Very light activity did not improve, and in fact decreased cognitive function if you were waiting approximately 20 minutes after exercise to retest cognitive function. So it may be time specific and intensity specific in terms of when we expect cognitive function to occur. But note that even after a delay following exercise, particularly hard and very hard exercises, so that vigorous intensity, was associated with improvements in cognitive function much later after exercise. So, and we don't have that data for immediately following exercise. Probably, right, because there are some concerns with doing vigorous exercise, immediately stopping and testing something. There could be some decreased blood flow, decreased perfusion to the brain. You could see someone losing consciousness, maybe some increased likelihood of cardiac events happening. So in any case, pretty interesting study. And this is sort of is the context for what we did in class on Thursday. Okay, last couple of slides here. So now moving from cognitive function, I wanted to look at happiness a little bit, mostly because we spent the first half of the semester talking about disease. So I wanted to then talk about quality of life. And okay, yeah, we don't want to be sick, but if you're not sick, then what about just improvements in life satisfaction, for example, like this study examined? And I, of course, like this study because although Zhang is very well known in this field, looking at subjective experiences. So in any case, when measuring life satisfaction and performing vigorous physical activity, we saw improvements in life satisfaction, improvements in happiness, improvements in positive affect, which is just another way of operationalizing happiness, essentially. And then decreases in negative affect. So negative emotions were likely to decrease with engagement in vigorous physical activity. Now, we did see some significant effects with moderate physical activity on happiness and positive affect and negative affect, though not in life satisfaction. And then with just walking, there was no significant association with any aspect of sort of subjective well-being is how we would operationalize this. I will say you do always want to pay attention again to magnitude. So R squared is saying how much of the variation in life satisfaction was due to this one variable. And the estimate here is that only 3% of life satisfaction was related to the physical activity variable. So maybe not a huge amount. With happiness, we got a little bit higher score, 7%, and with positive affect, 9%. So if you told somebody that you could improve their happiness by 10%, most people are pretty interested in that. And certainly if you move into a performance setting, if you told someone, an athlete, you could improve their performance by 10%, they're going to be super pumped and they are going to go for that. So although it feels like a relatively small magnitude, it does have a significant impact. And then with negative affect, again, we're looking at about 10% there as well. So negative and positive affect seem to be pretty significantly affected by especially vigorous physical activity. Okay, this summarizes a lot of time that I spent looking at happiness in the literature, just to try to give you some interesting data to think about for your own lives as you practice with other people, and just if you're interested in looking at research in the future on this topic. So to summarize the data, physical activity quantity correlates with stress tolerance and mental well-being. As little as 10 minutes a day or one time a week, independent of type, physical activity, you have a positive impact on happiness. So physical activity just helps you be happier. That is mediated by health and social functioning, which, real quick, just a reminder, mediators are on the causal pathway. Okay. So, physical activity might be, well, we know that it's going to have an improvement on health and an improvement in social function. And through those, so health might be directly affecting happiness and social function might be directly affecting happiness. So there may be some mediation happening there. Variety does seem to slow hedonic adaptation, and all that means hedonic adaptation, hedonism is the idea of happiness. So hedonic adaptation just means your positive response to a given stimulus. Okay, so what this is saying is that if we vary physical activity, that we're less likely to become used to that given type of activity and still likely to see improvements in happiness with a variety of physical activity as opposed to one single physical activity. That's what we see in most of the literature. However, I think this was the Okapi paper in 2021, and they showed that self-directed positive activities in daily life. So this wasn't just physical activity, just for the record, but self-directed positive activities. And you could go to the paper to find out what exactly those were. But increased variety was associated with actually smaller boosts in subjective well-being and less effective and engagement in less effective activities. So we don't see this in every case. It looks like maybe consistency in activities that truly result in improvement is better than trying to jump from one activity to the next to still get that same sort of dopamine bump, for example. Moving on to sleep, sleep quality does look like it matters more than sleep duration. So if we come down, this is a figure from one of the Zhang papers. And looking at sleep quality, we're just looking at the magnitude of effect here, right? And we're seeing 0.16, 0.39, 0.34. When we come down to sleep duration, that drops to about half of that. So 0.15, 0.1, and 0.2. So it looks like sleep quality might be more important. They're both important. They're both having an effect. But if you're going to choose quality or quantity, it looks like quality is the more important. However, short sleep was associated with lower positive emotions, and poor sleep was associated with more negative affect. So improvements led to reduced mood disturbances. So decreases in depression, especially, would be something I might want to focus on with quality. Whereas if I just want to improve my life and be happier, increasing the duration of my sleep might be the more important area to focus on. Nature exposure also, this study I think was really poorly done. There was a complete lack of control for sleep or physical activity here. But when you compare someone that is exposed to nature as opposed to somebody who, so a nature intervention for 2 weeks and then a physical activity intervention for 2 weeks, and you just compare those two people, you saw improvements in health, well-being, diligence, and fatigue in both studies. But in the nature study, you also saw improved nature identity and connectedness. So if you can get some additional benefit from nature, right, it looks like that's effective. And there is really interesting nature research. However, I think this particular paper wasn't well done, and it's not my field. So, but nature does seem to have an effect on our subjective well-being in any case. So to summarize, increased physical activity, sleep hygiene, and bedtime routines improve subjective well-being regardless of race, gender, or socioeconomic status. Okay. I would love to go over this figure more, but I want to get through this lecture in hopefully 30 minutes or less. So I'm going to skip it. But if you want to dive into this and know what things like wake after sleep onset mean, and et cetera, I'm happy to sort of talk through some of that with you. Okay, this was just a great figure that I really like. It shows that, right, mood is shifting either in a positive way, a negative way, and some of the different factors that may be affecting that. And just know that there's a lot of interplay between factors, right? So it's really hard to boil things down to a single factor. And that's not even considering, right, this aspect where we could see some mediating happening or a moderator variable in play, right? So doing research is really hard, is really, I suppose, what this slide is getting at. It's hard to isolate single variables, and it's complex how sleep or physical activity or nature exposure might be affecting our subjective experience. Okay, and then I know a lot of you engage in resistance training, and this was a paper done on young adults, so it really applies directly to you. It was a randomized controlled trial, so should be some pretty good data to look at, and they were looking at depression and anxiety in response to a resistance training protocol. So at baseline, these were depression scores. And I believe with this study, a a depression score above 6, I think. I talk about this in the next slide, in the next video, so I'll get more specific, but was associated or was diagnostic criteria for depression. So in any case, what we saw here, so you have a resistance training group and then a waitlisted group. So they were told they were put on a wait list, which they were, but they weren't engaging in resistance training. And they looked at the depression scores. So both had been diagnosed with major depressive disorder. And so you see similar scores here, 10.6 and then 11.3. However, after 1 week of resistance training, the depression scores in this group had gone down to 6.2, whereas, right, no significant change here. Then when we go to week 4, so 4 weeks of resistance training, now down to 4.9, 9.8, and then 2.7 and 9.7. Okay, so we see a pretty clear dose response relationship happening here. So decrease in depressive symptoms with engagement in resistance training, and that the longer you do it, the greater reductions in depression that you have. Similarly, with generalized anxiety disorder, we saw a really similar association. So starting with 11.4, at week 1, they dropped to 7.1, then to 5.8, then to 3.3, whereas in the waitlist group, no significant change across the 4 weeks, okay? So resistance training does decrease major depressive disorder and generalized anxiety disorder. Okay, and then I'm gonna tie another video onto this to go over the article specific content. Okay. This week you're reading an article looking at depressive symptoms. The first thing I wanted to talk about was weighted means. All that means is that they had a certain number of subjects. It was over 3,000 subjects here, and they look at the US census data. So every 10 years, the US tries to just document the number of people in a society with a given demographic. So it looks at age categories and race categories specifically. So let's say 75% of the US population is non-Hispanic white. And I think that's actually relatively close to correct, but don't quote me on that. What this does is in your sample of 3,000 individuals, let's say 2,000 of them were white, non-Hispanic white. That would mean that's 66%, right? Whereas if the actual number is 75%, everyone in this category, they're going to weight that data just a little bit more because it means that it wasn't representative of the US population. Okay, so, and that's what they're trying to do is make a nationally representative sample here. So you are weighted based on your demographic. And so typically older adults are weighted a little bit heavier because they're harder to enroll in studies. And so I'm going to not have a representative number of older individuals in my study. So I've got to weight their data a little bit more, meaning each individual point that I put for an older adult is going to shift my line just a bit more than for, let's say, a 20-something individual who's white, right? They're probably the most prevalent in any research study. Looking at IPAC versus accelerometry, IPAC is self-report data, and accelerometry is what we would consider objective data. So accelerometry is you're wearing usually something on your wrists. So a lot of you have, let's say, an Apple Watch. That would be an example of a triaxial accelerometer. Sometimes individuals or studies will use hip accelerometers or ankle accelerometers as well. Both have been used successfully. What I want to avoid is oftentimes when we talk about self-report versus objective data, we sort of discount self-report data, but self-report data is really useful. We talked about self-reported health earlier as being a good predictor of longevity and quality of life, right? So self-report data may get at slightly different aspects of physical activity than objective data does. And so I think both are helpful in different ways. And I want to discourage you from discounting studies that use self-report data because they're really helpful. One of the things that this study points out is that accelerometer data doesn't look at Um, it doesn't look at domains of physical activity. So it can't separate whether I'm doing resistance training or aerobic training. It can't separate whether I'm doing domestic house chores or I'm taking the train to work or biking to work. It can't differentiate between those things. And we know that some of those things may have a differential impact on health. So one other thing that comes up in the study is in the accelerometry data, they did not require that individuals measure using a weekend day and weekdays. So they were supposed to wear the accelerometers for 7 days, and they required, in order for them to be included in the study, they had to have at least 4 valid days of wear time. And we can talk about what that means if you have questions. But in any case, they had to have at least 4 days. In many studies, if you are doing something like that, you'll say, okay, 3 of those days can be weekdays, but at least one has to be a weekend day because we know that often people's physical activity, people's sleep, people's nutrition changes weekday to weekend. And so we want to try to capture some of that in these studies, and they didn't require that in this study. So big limitation there. They talk about logistic regression. So they perform regression. And all logistic regression means is that your outcome variable is binary. So either you have depression or you don't. Either you have depressive symptoms or you don't. That's what that means. And logistic regression is going to spit out the result that you're getting is called an odds ratio. So that's just the likelihood of an event occurring. So the likelihood of depression or not depression. Intention to treat, I wanted to bring up again, only because this article says something about how physical activity has similar effects to antidepressant medication. And I think it's really important to distinguish between per protocol analyses and intention to treat analyses. What it's often referring to, and I'm not saying that there aren't studies that do intention to treat analysis, but what it's often referring to is per protocol analyses, meaning that these studies are comparing antidepressant drugs to a physical activity protocol, but the physical activity protocol that was followed perfectly. In real life, most protocols are not followed perfectly, and most individuals don't have the support that they need in order to follow these exercise protocols perfectly. And so it's a little bit dangerous to tell people, oh, well, you can get the same effect from physical activity as you can from an antidepressant. That's true if you follow the protocol correctly. But if you don't, you might not get that benefit. And then you haven't taken the antidepressant and you're not getting the benefit from the physical activity. So we may see declines in mental health. Now, as someone who's in the physical activity space, obviously I'm a big proponent of physical activity. However, you want to acknowledge its limitations and the ability that people have to implement a physical activity regimen. Okay, symptoms versus diagnosis. This study talks about depression, and the tool that they use is a validated tool to measure depressive symptoms. However, it's not used to diagnose depression. So that's a pretty big difference. And I want you to pay attention to, in this study, mild depression is categorized as, I think, a score greater than 5 on this particular measurement tool that they're using. Moderate depression is, I think, 9 or greater, and then severe depression is 15 or greater. Notice those magnitudes and how they changed with physical activity or sedentary behavior. Long story short, neither the physical activity neither those meeting physical activity guidelines nor those not meeting physical activity guidelines were classified as even experiencing mild depression. So although there was a difference in scores, there's a huge limitation in that there weren't a lot of depressed people in this study. So anyway, take that with a grain of salt. And then the last thing I wanted to touch on was the prevalence of meeting physical activity guidelines. They talk about meeting it in bouts of 10 minutes or greater. That has since been removed from the physical activity guidelines. So we know that you don't have to engage in physical activity for 10 minutes or more in order for it to have an effect. And so they harp on that a lot, and that comes up a lot. Just know that that has changed. That changed in the 2018 DHHS guidelines, I believe. So anyway, not the case anymore, although there was some research to support it at the time. It seems like things have shifted in the research world. So in any case, good luck with the article this week, and I will see you in class on Thursday.